Good afternoon. Thanks for joining us for our webinar this afternoon. Our topic is on family engagement and treatment. A lot of our webinar topics are, there's a psychoeducation piece to them, but this one is really targeted toward family members who have a loved one in treatment or are wondering how to navigate that or how supporting a loved one in treatment might look like. So hopefully you find something helpful or interesting as we're going through the slides this afternoon. Um, just our usual housekeeping. There are some helpful links at the bottom of some of the slides, including a link to our archive of past webinars. We're quickly coming up on 2 years worth of webinars, so that could be helpful to check out. And we'll give it just another few seconds here and then we'll get started with the slides. Okay, so we do have a Q&A box, so if you have any questions as we're progressing through the slides, you can go ahead and throw them in there. I'll keep an eye on it and we'll try to work through any questions before we get too far away from that slide. But otherwise, I'll make sure to check in quickly at the end as well to see if there were any that came in. Again, we're quickly coming up on 2 years of webinars, so if you have any suggestions for topics that might be helpful or interesting, please feel free to add those to the Q&A box as well. Okay, our objectives for today, we are going to just do a quick summary about some of the impacts of addiction on family members, talk about what family engagement can look like, um, discuss the value of family involvement in treatment, including benefits for the family unit. I may have flip-flopped the order of that in a little bit, so bear with me. Then we're going to talk about just some common questions about treatment and about engagement in treatment that family members have asked. And then we will kind of round out with family support, healthy boundaries, and some resources for family members as well. So the phrase "I'm only hurting myself" is something that I have heard periodically through my years in the field, and usually when people are not quite sure if they're ready to change or still have some reluctance to changing their patterns of substance use, this is a phrase that can come up, and it's just not accurate. Um, the behaviors of somebody who has a substance use disorder or an addiction really have a ripple effect that we see impact the family, the community, and society. But of course, today we're going to focus on the impacts on the family. And that includes emotional, psychological, certainly financial, and social interactions as well. So we see substance use generating a breakdown of trust in the family. There can be a sense of loss or disappointment, especially as the substance of choice can be prioritized over the needs of the family and those relationships, quality time together, and just the heavy emotional toll that the substance abuse can take on the family members, in addition to the person using the substance. So just really quickly, I did want to talk about, there was a study that I found previously for one of our webinars that I wanted to kind of sum up today because I think it's meaningful for talking about this scope and then, how this ties into families participating in treatment. But there was a study done, this was in 2018, so a bit of an older study, but it was done with participants in Iceland and they wanted to explore the extent to which the use of drugs or alcohol by one family member impacted the family, and specifically emotionally and socially. So they used an instrument that's called the Depression, Anxiety, and Stress Scale, and there were about 143 participants, mostly women, but they ranged in ages from 19 to 70 years old. And they were relatives of an individual who was seeking treatment at this National Center for Addiction Treatment in Iceland. So they had kind of a nice spread in terms of the relationship of family members. So they had some adult children of a parent with a substance use disorder, spouses, parents of a child with substance use disorder, and siblings. And they took a look at ratings of depression, anxiety, and stress. So what they found was that 36% or more of the participants in all three subscales had average, serious, or very serious depression, anxiety, and or stress. So that is significantly higher than in the DASS studies of the general population. So, and they also found that it didn't really make much of a difference in terms of the relationship to the family member with the substance use disorder. So, it was higher than the general population, but it didn't matter if the person in treatment was a spouse, um, a child, a parent. That didn't have an effect. So the value of family involvement. So family involvement in substance use treatment can't be overstated. And this is a common slide that we circle back to, but it's just so important. The involvement of family members in treatment is important for two big reasons. Um, First is that families are negatively affected, and family services can help to reduce harm to both individual family members, but also the family unit. And then family participation in substance use disorder treatment um, improves treatment outcomes, kind of generally speaking. But we see that it increases entry into treatment, it improves rates of treatment completion, and is linked with better treatment outcomes for the individual who is coping with a substance use disorder. So we see longer periods of sobriety oh gosh, sorry, compared to individuals whose families um, are not participating in their treatment. Sorry about that. The family member can really be an important factor in engaging individuals in substance use treatment at the beginning, because they may be more likely to recognize signs of substance abuse compared to the individual with the substance use disorder who may not recognize or acknowledge the problems of their use. Family members also tend to be highly motivated in treatment and typically want to help their loved ones reduce their substance use, improve their relationships, and also ease their own difficulties stemming from that person's substance use. So that can have a nice impact on motivation, remaining in treatment, and following through with aftercare recommendations. Additionally, having a family member involved, and we'll get a little bit more into this in the next several slides, but can help the treatment team kind of identify and address challenges within the family dynamic, um, things that may be knowingly or unknowingly contributing to substance use or continued use, triggers, and it can help set the person up who's in treatment to be discharged to an environment that is going to discourage a relapse and really set them up to be as successful as possible in terms of their aftercare and living environment. So, family engagement can take a lot of different forms. So, we're going to go into each of these a little bit here. So, first and foremost is learning about substance use disorder itself, treatment, and also recovery. So, foundationally, knowing that substance use disorder is not a matter of willpower, it's not a moral failing. It's a disease process that hijacks the brain's reward system and disrupts the part of the brain that's responsible for impulse control. It also creates associations and memories with the individuals using that can result in or cause a lot of different commonplace things to be potentially triggering for the person who is trying to get sober. So, knowing more about triggers, substance abuse patterns, and relapse processes can help a family member share insight with their loved one and with the treatment team. And like we just spoke about, sometimes that's insight that the individual hasn't even developed yet or maybe is not in touch with quite yet. Similarly, as with most chronic disorders, relapse rates are high. So, approximately 40 to 60% of individuals relapse within the first 30 days of leaving a residential treatment, and many others relapse within the first year. So, developing an understanding of substance use disorder can help family members to kind of connect with some compassion when dealing with the challenging emotions stemming from a loved one's relapse. By learning about substance use disorder treatment and recovery, family members can really develop a foundation of knowledge to help their loved one navigate treatment and subsequent challenges that they might face during the process of treatment and recovery. Provide emotional and recovery support. So, showing a loved one encouragement and support can really speak volumes and be really bolstering for somebody who's trying to get sober and is, grinding through day after day and trying to reestablish patterns that are healthier, and sometimes that involves a lot of change. So having that family support piece is huge. A few simple words of encouragement can really go a long way. And recovery and emotional support can look different depending on your loved one's treatment and length and sobriety. So, for someone in treatment, recovery support could look like affirming the need for treatment, and even setting boundaries to not enable somebody to leave treatment early. That can be a really common one. But it could also look like encouraging a loved one to attend like peer support groups, NA or AA, Smart Recovery, all the different peer based recovery support meetings, outpatient treatment, mental health counseling, and other recovery related activities, or even just getting involved in the recovery community, nearby. Participating in intake and aftercare planning. So, um, providing information to the treatment team at intake can really help, can be super helpful to the treatment team in knowing what the areas of need are for the person that's in treatment, getting an accurate understanding of substance use patterns, consequences, and their strengths and supports as well that can be kind of tapped into and used through the treatment process. So it can be really helpful to get another perspective when we're engaging in that information gathering process to make sure that treatment is as effective as it can be and that we make sure that we are um, tying in all the pieces and the supports into treatment that would be helpful for the client. Similarly for aftercare, um, a lot of treatment providers really advocate to have a family session nearer to discharge. And that can just help make sure that everybody is on the same page with what is being suggested for aftercare, and the support services and resources that are available or can be offered. A family session nearer to discharge too can also give family members the opportunity to talk about their feelings and also communicate some expectations and boundaries, especially if the loved one is returning to the family home following treatment. So that can just be a nice opportunity to, again, ensure that everybody's on the same page, but also talk about what this is going to functionally look like. You're getting out of treatment, particularly residential treatment, and we're going to um, talk about what the expectations are so that you can be successful. Attending family groups or sessions. So, family groups can be a helpful way to, if they're educational, they can be a helpful way to increase family members' knowledge about substance use disorder and recovery, as well as specifics about the program that the loved one is involved in. Family groups can be offered about a range of topics, and a piece of them can look kind of similar to what we cover in the webinar series. But an additional benefit of family groups can be hearing from other people, from other family members with a loved one in treatment, and the validation that goes along with that, or hearing feedback from other family members about a situation that you are in, and just that validation and realizing that the family's not alone with these challenges. Family sessions are a little more directed than family visits, which we'll talk about next. But family sessions can be to discuss a specific topic or challenge, but it can also be to use to look at the family relationships, the interactions, and the communication patterns between the members of the family, and help to have the person facilitating intervene and work to improve those communication patterns and dynamics. So family therapy can be really helpful at taking a look at those patterns in the family, and that in and of or that can also benefit the individual with a substance use disorder move forward in their sobriety, but also get the whole unit to a healthier level of functioning, especially because as somebody is progressing forward in their sobriety, that can involve a lot of change then for every other part of the family unit. So it can be really helpful to tie in at any point in treatment. Participating in phone calls and visits. So for residential treatment, this is kind of a simple way that you can just engage with your family member and support them while they are particularly in residential treatment. And is a little bit self-explanatory, so we won't belabor the point, but um, it can be a nice way to help keep your loved one encouraged, especially in the treatment process, especially considering how long they may be in treatment. It can just be kind of a bolstering effect to get them through and keep them doing what they need to do in terms of treatment. And lastly, practicing self-care and seeking counseling and support is also family engagement and also benefits the loved one with the substance use disorder. So proper self-care and support will not only help you, but it can also kind of model for the person in recovery related behaviors. Support for loved ones, and I have some of these on slides at the end, but they can be through mutual help groups, things like Al-Anon, Nar-Anon, Smart Family and Friends, and some other groups, or family support groups provided by various treatment centers or treatment providers as well, can be something to look into. So benefits for the family unit or the family members. Um, Again, having a better understanding of the substance use disorder and the impact on the person's behaviors potentially. Becoming aware of family dynamics and maybe becoming aware of family patterns that maybe aren't functioning the best and that could be improved in order to benefit everybody in the system. Um, Along those same lines, treating everybody in the family system obtains the most positive outcomes. So it can help ease the transitions that will happen within the family as somebody is getting sober. Improves communication, can help start the process of regaining trust, um, and kind of models healthy ways to express feelings. Um, Improving communication all around and working on setting appropriate and healthy boundaries as well. And that can be boundaries for the person who is in recovery themselves, as well as boundaries from the family members. And learning self care and building support that we talked about already. So, some common questions about treatment, and this kind of deals with family engagement, some pieces, but also are just some kind of more general questions about having a family member in treatment. And um, one of those can be, what is my loved one learning while they're in treatment, or what are they doing while in treatment? And treatment goals can vary from person to person and should vary from person to person to make sure that we are meeting their needs individually. But kind of general or overall, generally, treatment generally involves learning about the substance use disorder, helping the family member, the individual, to identify what their triggers are, um, engage in relapse prevention planning, either building supports or figuring out what supports they might be able to connect with. And um, this can also be techniques for addressing different mental health symptoms, talking about the importance of aftercare, and just generally kind of building some coping skills to deal with different urges and challenging emotions. This is also a little bit different depending on what kind of treatment, whether it's residential or outpatient, that the family member might be engaged in. But overall, these are some areas that treatment targets. Okay. Why can't my loved one's treatment team tell me more or tell me anything? So this one is a common one that I really wanted to make sure that I spoke to for the webinar. Um, so we still, the short answer to this is consent, whether or not there is one, and also what kind of information that the person in treatment has agreed to being released. So if you have called treatment and are the staff is responding in such a way that is really on the fence, can't confirm or deny, it generally means that there is a lack of consent or that the person is not there and they really can't confirm or deny whether or not they are or have been or are not anymore. Um, but additionally, in terms of the the client, the loved one is still identifying what information that the treatment team is able to disclose. So that might just be that they are here in treatment or they are not here in treatment and nothing else. So it's still really in the hands of your loved one, of the person that's in treatment, to identify what the treatment team can and can't um, communicate about. And I think, at least in terms of the clients that I have seen in residential treatment, I think we're still kind of coming up to speed in terms of involving family members at that level of care and really starting to advocate for that. But a lot of times the family members aren't ready or willing at that point yet to have their family members participate in the treatment process. So that's something that we're kind of chipping away at. But to circle back, we are limited by consent in terms of what we can and can't say, or if we can even acknowledge that a person is in treatment or not. Okay. How often does my loved one have individual therapy or group therapy? And it depends. It's really the short and sweet answer to this, but it depends on the level of care that your family member might be in. And this is a nice, or this is certainly something that you can ask the specific treatment team. But for inpatient treatment, 3.5 residential treatment, they have generally multiple therapy groups per day, in addition to other like recovery classes or activities. Usually some in-house peer support meetings per day, and then at least an hour individual session once per week. But a lot of times the treatment team is meeting with the with your loved one multiple times per week, at least touching base, checking on them to make sure that things are going okay. Um, but this is kind of the general statement. Um, it again varies depending on level of care too, but is certainly a question that um, your loved one's treatment team can give you some information on. Why does my loved one need to be in treatment for so long? And why does my loved one need residential treatment, intensive outpatient treatment, those kind of things? So, treatment level of care, so whether it's residential treatment, intensive outpatient treatment, partial hospitalization, halfway house programming, and treatment length are based on certain criteria and different risk ratings. So that kind of gives the assessor an idea of whether that person, the risk is so much that they need to be at a certain level of care. Um, and it is always with the dimensions that we use, it is always the least restrictive level of care that is still going to meet that person's needs. Um, And I did include what those dimensions are just for if you're interested, but it can include withdrawal potential, if there's any medical conditions that are co-occurring, emotional conditions or mental health conditions, um, how ready they are to change substance using behavior, their relapse risk and recovery environment and different supports at home. So these are kind of the big areas that the assessor will take a look at to determine, is outpatient treatment once a week going to be suitable for this person, or why this person may have to go into withdrawal management services, where this person can go right to rehab, where this person can just do partial hospitalization and doesn't need to go to a residential facility. So it's a little bit more nitty gritty than that, but this is kind of a bigger picture of what that looks like. And as long as somebody is still, and treatment length is determined by progress. So you know, back in the day, we used to have short-term and long-term treatment. It used to be kind of a flat 28 days and you were done. But now it's determined by taking into account some of these things, but also how the person is progressing in treatment, what other situations have maybe come up or factors have come up that need to be addressed in that treatment setting versus a lower level of care. So a lot of different factors can come into play in terms of determining treatment length. And my loved one wants to leave treatment, and can't you just keep them there? So clients are always able to leave treatment if they would like to. So that doesn't mean that staff are just kind of like propping the doors open and letting them head on out of the facility. We do use interventions to try to prevent clients from leaving treatment early and point out possible consequences too. Setting boundaries with a loved one who might want to leave treatment can help them really stick and stay until they are stable enough to leave and be successful at the next level of care. So that's something that we're considering too when we're determining treatment length and whether or not this person is ready to go home or go to the next level of care. Is this person demonstrating that they can continue to be successful and are stable enough that they can have less treatment. So, family support and healthy boundaries is something that we've touched on more in a couple of previous PowerPoints, but I just wanted to spend a couple seconds here. So, support is really providing aid while still letting your loved one experience consequences of their decisions. And support doesn't deplete your own strength or resources. So, supporting can really look like giving them tools, helping them access resources, being an advocate for them, encouraging them, but it is not offering excuses. Um, it is not encourage like providing them with means to continue those behaviors that are harming them, uh, and generally involves family support, and supporting a loved one in recovery means having healthy boundaries. So those kind of limits that people set as a way to safeguard your own well-being, um, and the process of choosing boundaries to help your loved one take responsibility for their behaviors, which can then motivate them to change. So for creating a boundary, and again, we go into this more in one of our past webinars, but boundaries are not punishment, they are protective. So it is managing, right? If I'm setting a boundary, it's meant to activate my behavior, rather than communicating what you need to do in this situation, as a directive or as what you're telling your loved one. So boundaries can a nice framework can be stating what the issue is, what the desired actions are, and if that doesn't happen, what the consequences are going to be. So, not following through with those consequences can really make boundaries seem like an empty threat or a warning. Um, so just for an example, the family, we have this family outing plan. We're going to an amusement park. We're not going to wait for you to show up when plans have been made to attend an event because you're using or because you're sick. If you are not here, then we are going to continue with our plans. And again, boundaries can vary depending on the family. But this is also a piece that family therapy or working with a treatment provider can help you navigate what this could look like to best support the person who is in treatment and who is trying to get sober. Lastly, just some quick resources for families. SAMHSA and the Betty Ford Foundation have a whole bunch of informational resources in terms of substance use disorder and family participation. Here are the names of some peer support meetings, including some virtual ones. Partnership to End Addiction is specifically parent support groups for parents or caregivers of children with a substance use disorder. And even sometimes behavioral health organizations can have some resources. I found this whole page really of resources from Community Care Behavioral Health that I thought was worth kind of bringing up. And there may be some from the other behavioral health organizations in the state too. But I was kind of surprised and wanted to throw that one on there as well. But that kind of takes us out of our family participation and treatment in our webinar today. So our next webinar then is July 16th at noon. And we're going to talk about halfway house, level of care programming, differences between halfway houses and recovery houses. And we're going to kind of dive into that a little bit. So we hope to see you in July. And thanks for joining us this afternoon.